I'm Elizabeth Mumford. I'm a veterinarian. I'm an epidemiologist as well. I came to WHO in 2006 working on zoonotic influenza. And at that time it was H5N1, but the work became bigger and grew into other kinds of zoonotic influenzas. And then it segued into being more about all kinds of liaising with the animal health sector on all kinds of different zoonoses, both from the technical side, building the technical relationships, especially with zoonotic influenza, but also building just in general the relationships between OIE, FAO, and WHO. So everybody has heard in the news more and more reports of diseases that come from animals and go to people. Ebola was a big one. SARS was a big one. Now it's Middle Eastern Respiratory Syndrome, or MERS is Ebola. All of these. They're causing huge impacts on public health. And as well, diseases that go from animals to humans that have been around a long time. For rabies and anthrax and brucellosis, they're also continuing to cause impacts to public health. And these kinds of diseases where we have human health and animal health, and sometimes we have also the environment sector. So we have increased irrigation in places, or changes in the management of fields or forests. Those impact diseases as well. And these systems become very, very complex. And one sector, the human health sector or the animal health sector, any one sector can't handle that alone. They can't understand all of the aspects of it, and they don't have the expertise and the information to alone control it, prevent it from happening again. So the stakeholders aren't just human health and animal health. Often we hear human-animal interface and we just think of that. But there's a huge number of potential sectors that are involved and disciplines that are involved. And the sectors and the disciplines that need to be involved depend entirely on the question, on the health question that we're having, or the health problem that there is. So some of the sectors may be human health, of course, animal health, environmental health, that can be wildlife, that can be water, that can be food borne, that can be the presence of disease agents in the environments where humans and animals live. Any number of sectors may need to be involved in these conversations. As well, many disciplines. So we need laboratory people to understand the virus or the pathogen. We need epidemiologists to understand how the disease is spreading through different animal or human populations. Sometimes we'll need insect experts or fish experts or wildlife experts. Sometimes we'll need communications experts so that we can provide good messages to people so that they can decrease their risk. Sometimes we need experts in social systems and anthropology, because they'll help us to allow people to make better choices about reducing their risk. So lots of sectors and disciplines may be involved. And depending on the level of the problem, so we may have a problem just in a farm, or we may have a problem in a country, or we may have a problem in the world. And depending on that problem, we need to make sure that the political will is there. So the political sector, the security sector, we need the financial sector to be involved in the conversations, because it takes money to control diseases. So there's not one definition of One Health. Everybody who's working in health can see One Health differently, and they can take One Health approaches in whatever way that they're dealing with health. Nurses or researchers or people in the field can all take One Health approaches, and that may mean different things to them. In general, what we think of when we say taking One Health approaches means that approaching a problem by getting all of the different sectors and disciplines that may have a stake in that problem, may be stakeholders to that problem, to the table, making sure that they're part of the conversation. So basically, when I talk about One Health, I mean four things. I mean communication, so sharing information among everybody, coordination, so that people know what their roles and responsibilities are, collaboration, working together, and very importantly, making sure that all of the people that need to be part of that conversation are there at the table. In countries, ensuring multisectoral collaboration or ensuring a One Health approach often means strengthening the individual systems, the sectoral systems in that country, and then building bridges between them. So we want a very strong public health system. We want a very strong animal health system. We want strong other systems, environment, wildlife. We want those systems to be very strong. And then they can work together. They can build the bridges, the mechanisms, and the tools for working together. A very good example of this is multisectoral coordination committees or ad hoc committees or task forces in countries, which come together on a routine basis to discuss One Health issues, discuss issues of joint concern. They may plan surveillance together. They may do joint risk assessment together. They may write a pandemic plan together. They may just decide what they need to do, what are the priority issues in the country that they need to work on together. But you have a system, an established system, people that work together on a routine basis. In many cases, the individual systems aren't that strong. We see developing countries with weak human health systems, with weak animal health systems where we're trying to build capacity. That doesn't mean they shouldn't try to work together already. But the goal isn't to have one integrated system. The goal is to have very strong health system, public health system. Build that up as much as we can and have very strong animal health systems and other systems. At the same time as we're building those, they can be collaborating already, absolutely. What we mostly see is that One Health ministries or agencies don't really work that well. What seems to work better is to have staff, technically competent staff, working in their own sector. They're in their ministry, they're in their agency, they're working on their own technical work. And then, on a routine basis or as needed, they come together and work together on some kind of One Health platform or multisectoral committee. This is also what we see works best with academic programs. So instead of having a One Health program, you have students working in their technical programs. They're learning how to be a technically sound scientist or medical doctor or veterinarian or water specialist or chemical radiation specialist, but they have courses and classes where they come together and problem solve and learn how to work together to solve a problem. But just because there isn't a national ministry or a program or an agency responsible for One Health, that doesn't mean that there shouldn't be some functional unit that takes responsibility for making sure multisectoral approaches are taken in that country or that program or whatever the agency may be or whatever the situation may be. For example, at WHO, and as well as many of our partners, our UN partners and other government partners, have One Health units or One Health platforms or One Health functions. And those units don't do One Health. What those units are best set up to do is to make sure that multisectoral approaches are taken in that country or in that agency or in that department or in that program. So they are the ones that are making sure, we are the ones that are making sure that all of the partners are in the conversation and are at the table, and that those partners are identified correctly. The other thing we do at WHO as well, and at some of the other agencies that we work with, are developing tools and guidance for countries so that they have some idea when they want to go ahead and take some One Health approaches to build a platform or to do joint risk assessment, that they have tools and guidance, standard guidance that they can use to base their country activity on. Right now, there's very little evidence-based tools and guidance out there for countries to use when they want to start to implement some of these multisectoral activities. So we're trying to build scientific-based standard guidance for countries. The other role of a One Health unit or a team or a platform is to keep it in the front of the consciousness that people need to take a multisectoral approach. So that research units are including other partners when they're developing their research, or surveillance units are making sure that they get the data from the university even though it's not part of the government system. Just keeping it in the front of people's minds. The first and most important thing is to try to establish trust among the partners. Trust is crucial because you need to work together routinely, you need to share data, you need to try and identify your common goals and the benefits that you can share. Trust is also something that's really difficult to build. It's also very easy to break. And it's even harder to rebuild after it's broken. So another key element is, as I mentioned with the trust, is trying to find and identify areas of joint benefit. So if everybody sees where you're going, and it may not be the same benefit with the different sectors, but if everybody sees that this activity will contribute to their own benefit, then it's much easier to get buy-in and everybody can work more smoothly together. Another element is to have strong mechanisms in place in the country for working together. We see sometimes, especially at the beginning, countries trying to build these relationships and they end up being based on individual relationships. So that person works really well with that person, and so they talk on the phone, and it's great, and they share, and it works really, really well when things are new and when they're small. But after a while, it's not sustainable because one person may go on vacation just at the moment when there's a big outbreak. So establishing mechanisms, standard mechanisms in a country for collaboration is much more sustainable. And the fourth key element has to do with political will. So it's very important to have political will for, especially at the country level, for establishing mechanisms to work together. A really good example is a Ministry of Health or a Ministry of Agriculture or Veterinary Services who wants to build a collaboration with the other sectors. They can go and call them on the phone and ask them to come to a meeting or ask them to build a platform for discussion, but it's up to the other partner then to say yes or no, or to see the benefit or not. So it's much easier if there's political will at one step higher. And one step higher, then the ministries can convene the ministries and say, look, this is important, you guys need to work together. And that will promote and facilitate establishment of good collaboration among the ministries. The key ones, I would say, are really to be careful about trust and respect, and to make sure that you are always trustworthy. And the other is just to keep in mind these very simple four things: collaboration, coordination, communication, and making sure that all of the right partners are in the conversation, that they're there at the table.